extremely pleased and very pleasantly surprised with the turnout of people we had here. It seems we had around or even in excess of 200 people at this public forum tonight discussing the opioid issue here in Carteret County. And we had a lot of good discussion by our panelists and had a lot of very good questions from folks in attendance. There were various stakeholders from the community who were present tonight, those of us who were actually in the field dealing with these issues, but there were a lot of people in the crowd who were not from law enforcement. They're not in the treatment community. They don't work at the health department. There were a lot of citizens who just came here tonight simply to listen to the discussion, get a better understanding of the topic. There were a number of questions or statements tonight about certain misunderstandings about what type of services are available, who may qualify, where do you go to get information, and that type of thing. We don't really have necessarily a one-stop shop for any particular service or even for information. And so I guess it would be incumbent upon many of us to provide as much information as possible to the public, whether it's those of us in law enforcement, whether it's the substance abuse providers in the community. And that was also mentioned as well. If you call and talk to one provider, if they can't help you, then they may refer you to someone else in the community so that you can go and get information or get a service at another location here in the county. If anybody has any questions about services available or need referrals, they can certainly feel free to contact our office or their other law enforcement agencies in their respective communities. Our health department, RHA, is a provider that's actually in the building where the health department is located. Moving forward, it's not like we can just have 2 or 3 meetings over the next couple months and hammer out a strategy and then just go out and change the situation over the next several months or probably even years. It's going to be a long-term effort in order to deal with this situation. It's taken us many years to get to where we are now. And there are a number of things that would have to be done with regard to changing the law, changing various regulations, best practices, law enforcement and treatment providers and other folks in the community working together collaboratively to deal with issues in the criminal justice system, drug treatment, reentry, helping people get back to work. All those things are going to have to come together over time to address this issue of addiction in general.